Dr. Paul here. We've got a compilation for you here of our most unusual, atypical findings, rare diagnoses, viral videos that just were odd or somehow didn't fit into any particular category. We put it all together for you here in this compilation. I know you're going to enjoy this. I'm Dr. Paul.
My eye.
Oh, let's look at that eye. So when did you notice your eye like that?
Yesterday.
All right. Is the light bothering it?
A little bit.
A little bit? Okay. So, does that hurt at all?
It feels a little bit irritated.
Yeah. All right. Do you remember like sneezing, coughing, straining really hard? I'm trying to think of, a burst blood vessel.
Yeah.
That kind of thing.
Not that I can think of.
Okay.
I got on a plane yesterday and then I didn't have it at the beginning and then I got off afterwards.
And that's when you first noticed it from the plane ride?
After the plane ride.
Yeah.
I didn't even notice it. My dad noticed it.
That's what I would call that a subconjunctival hemorrhage. Maybe there was just enough cabin pressure change on top of being sick that happened. So that's kind of interesting and totally unrelated to why you're here, I think, which is the possible mono. So what's happened since we last saw you?
Well, I still could barely walk, and then I eventually started to limp, and I could begin walking normally again. And all the blisters deflated, and either, I don't know if they just popped by themselves and absorbed into my socks or whatever, but they eventually just dried over, and it just became really dry, and then eventually just starts peeling off, in the shower.
Well,
4 to 5 days really is when it all started coming off. It comes off real fast.
Okay.
And it was really red a few days ago.
Right.
Just the raw skin.
Yep. So what happens when you've had a peeling skin wound is you have new skin forming from underneath, and that's what this skin looks like. And it's healed really nice. I mean, you've got, except for this little bit of crusting left over, you've got brand new skin that's now discolored for a while. That'll probably stay discolored for weeks, but eventually look perfectly normal.
And the first time this happened, they did this thing, and they looked a little discolored for a while, and they were totally
ended up totally normal. Very good. So, as you recall, because we haven't shared with our viewers what caused this, and we're starting to get a lot of questions. Well, what caused this? And as you recall, I called you the morning after I saw you the first time, and I said, I have a hunch, because it was so symmetric on each of your feet, that there was something going on with perhaps one of your shoes. What did the dermatologist say?
They said it was allergic contact dermatitis.
Okay.
So not an infection, no bacterial staph, nothing like that. Just a really bad allergic reaction to a chemical in my shoes, probably an adhesive. A lot of those aren't regulated. It doesn't say on the box or anything.
Gotcha.
So that's why they're doing the patch testing to see.
Okay. So when you see an unusual distribution of a rash, and we saw the fact that the distal third of his feet were just like a mess, as you've seen, for it to be on both feet, I was thinking more and more, this has got to be a contact thing. And that's what the dermatologist said. He's seen this many times. I will say, you did grow staph from that fluid.
Yeah.
And so had you not gotten better, we would have been aggressively treating a staph infection. Anytime you have a break in the skin, it's possible to get an infection. We all have staph on our skin anyway. So when you had that just open wounds, I'm thinking this might be infected. So who knows? The burn treatment idea didn't do any harm. But what you really needed was a strong steroid, and he gave you oral prednisone. So you were at the dermatologist this morning, and they did patch testing, I understand, on your back. Well, what did they tell you they were doing?
They're putting common allergens on my back, and they're very small, so if I had a reaction, it'd be pretty localized, and it wouldn't blow up, like this.
Yeah.
And they put 70 of them on there.
70. Can we take a look at those?
Yeah.
All right. So we have 70 different little patch tests. This is impressive. And of course, they've got them all labeled at their office of what's what. And you're to leave these on
This one's the shoe.
This is the shoe. Okay, number 8.
And the actual shoes.
The actual shoe. That's brilliant. What did they tell you to be careful about with this?
I can't get it wet or
Okay.
sweat excessively because that might mess with the results. And also, I had to stop taking the prednisone because that might
Okay.
interfere with
Right. It's
some-
such a powerful anti-inflammatory. It's not going to. You may not react if you're on prednisone.
Right.
Good job.
So are you sealing that cleft palate in the back with your finger now?
No, my finger's just in there. We've got a great effort here. So I think probably she's not getting as good a seal on the breast as she would if she didn't have that cleft. It is possible to breastfeed babies with cleft lip, cleft palate. It's tough though. Obviously, on a referral basis, we're gonna have this baby see the cleft lip, cleft palate team just so they can talk to you about at what stage they fix that. For the viewers, a cleft palate is that roof of the mouth is usually solid, and you saw a little defect back there. That was our cleft palate. And sometimes we have, there's that little clicking. So when I have a superficial latch, there's a lot more clicking than when I get it deeper.
Okay.
So just keep trying to really force your breast in as deep as you can. What's going on?
There's something in my ear.
What? Something in your ear? We've got something in the corner. Oh, there we go. It's got legs. And they're moving. Okay. Ta-da! There it is. Oh, that is so cool. We'll show you the film, okay? Afterwards, so you can see what we're oohing and awing about. So that. So what we've got here is a little teeny. I mean, this thing's only about 1 millimeter in size, but with this camera, we can magnify it, and we're seeing 1, 2, 3, 4, 5, 6 little legs that are moving, and a fat little whitish body of what must certainly be a tick that's embedded in your outer ear. Thankfully, it's on the outer ear part. So, I'm gonna need, Shadeen, I wonder if you could come help me. And if you held either you can go after it or hold the light for me. This camera, which would you rather do? You wanna hold that? Okay, so you can look. You're doing great, by the way. And if you wanna look, all right. Good? I think we got it.
Yep.
You can see, let's get, there it is. It shrunk, right? It got all shriveled up like, no. Yep, so there you see a leg, right? You see one little leg hanging off. Oh, that's exactly how it looked in your ear. See that? Perfect, we got the whole thing. See that? Isn't that cool? Wow, that's cool. We got the whole thing. So Emmett was born into our practice.
Yes.
As a healthy newborn.
Yep.
And what happened?
So we didn't have any idea that anything was wrong until
Right.
he was about, I mean, realistically like 12 months, but around 6 to 9 months,
Yeah.
he kind of leveled off with his growth chart.
Yeah.
So we just kind of kept an eye on him, and
Yeah.
by 12 months he wasn't crawling, so he wasn't meeting some of those bigger
Milestones.
like gross motor milestones.
Yeah.
So that's when you made the decision to
Yeah.
follow up with OHSU and their neurology clinic up there. In June of 2017, we got an MRI, and initially the brain MRI showed that there wasn't anything wrong. Then we followed up with the people up at OHSU, and they couldn't find any reflexes, any deep tendon reflexes, and so then they started to do some more tests. Meanwhile, he continued to grow and develop and learn how to talk and feed himself, and was starting to walk with assistance.
Okay.
And had
And that's
learned.
what age now? About 18 months?
Yeah, between 16 and 18
Okay.
months. And he was like getting around the house by scooting, which we weren't like too concerned about.
Right, right.
It was just how he was developing.
Yeah.
But then after he had something called an EMG, where they test the muscle, like they stimulate the muscle and they see how long it takes for the nerve impulse to get back to the brain.
Yep.
After that, he started to lose some skills. And so
Gotcha.
that's when things got really intense.
Yeah.
And they wanted to do a lot of diagnostic testing up at OHSU.
Yeah.
And then after the testing, he very quickly started to decline, where he didn't want to feed himself, he didn't want to eat. So we ended up having to place a feeding tube.
Okay.
And he was getting weaker and weaker, unable to sit up on his own anymore, support himself, move his head, and grab things with his hand. And we finally had a diagnosis on January 25th of this year.
And he was how old at that point?
Just before 2 years of
Okay.
age.
And by the time we got the diagnosis, how did they end up making the definitive diagnosis?
It was a combination between a genetic test and a blood test.
Okay.
So the blood test confirmed it. It was called a lysosomal enzyme function test.
Okay.
And that's where they saw that a specific enzyme was not being created in order to get rid of toxins in his nerve cells,
Yeah.
which is what is causing what's called a leukodystrophy.
Yeah.
Yeah.
And then I think the genetic testing found it to be specifically Krabbe's.
Yes.
Right.
Yep.
So there's about 50 or more leukodystrophies, and the Krabbe is one that they now do have genetic testing that can be done for newborn screening. I know that's been a real heartache for you.
Right.
Because you've stumbled on experts around the country who are doing some very creative treatments. If caught early before the demyelination of the nerves occurs, then they can do cord blood transplants or bone marrow transplants.
Yeah. It's a cord blood stem cell transplant. Yeah.
Right. And this is worth thinking about for people who are wondering about newborn screening and also about, should I bank my baby's cord blood?
Right. If you're not going to bank your cord blood, then you should at least donate it.
Right.
And that's free of charge, and yeah.
Right.
And it can save little babies' lives.
Yeah.
So, yeah.
Yeah. And you have found an organization, I think, that will help with this process of connecting families to resources.
Yeah. It's called Hunter's Hope Foundation.
Yeah.
And it was set up by Jim and Jill Kelly, who Jim Kelly was a NFL football Hall of Famer. I'm not I'm not a football fan, but I'm a fan of his.
Yes, Jim Kelly, we are a fan of yours for
Yes.
setting up this amazing foundation.
Yeah.
So as the liposomes, which are supposed to help you get rid of toxins, aren't able to do that, then lacking that enzyme, you can't myelinate your nerves. In fact, they start demyelinating.
Right.
So once a nerve loses its protective sheath, it can't conduct the
signal.
message.
Right.
The signal's gone. And so that's why you have loss of, the entire white matter of the brain starts being unable to connect and communicate. So I think you've already known that he's lost vision, correct?
Yeah.
Yeah. So there's a lot of nerves from the back of the eye, the retina, that go to the brain. That's the only way we can actually look at nerves as doctors, look at the retina, and they're not connecting anymore because of demyelination, and that all the nerves that go to the muscles, right? So he's lost his
Ability to
move almost, right? Or entirely.
Yeah, entirely. And he can't support his own head. So he's kind of floppy like a newborn.
Yeah.
is how I describe it.
Yeah. Unfortunately, when it's progressive,
Yeah.
and when it's this far along, that's what's been your sadness and heartache, is it's not reversible.
Right.
And so it's going to be fatal, and you have to, how do you deal with that as a mom? That's got to be impossible.
It is.
It's
it really
impossible.
is. Which is why we want to raise awareness and make sure that Emmett has the biggest impact that he can have with the life that he's been given.
Yeah.
So.
And he will.
Yeah.
He's going to have a huge impact.
Yeah.
This mom, she holds this guy 24/7 because at this point he can't see. I don't know if can he hear?
He can hear.
He can still hear.
He can still hear.
Okay.
2, 1. Why did I just get you? Why did I get you?
You know, everything, imagine the fear when you went from once having the ability, all those abilities and they're lost, and you're the only comfort he has.
Yeah.
So you're one of my heroes.
Thank you.
You know, some of us go about our lives and we're not aware of the suffering that's going on for others, especially when the suffering can be avoided, which is why you're such a champion for Emmett's life to have meaning. Oh man, it's hard to let go of your loved one. So you don't want to make a decision that would result in them leaving you.
Yeah.
So you have to like embody them. You live every body system of that child. You're it. Oh man, to live it as a mom and the little by little by little letting go, that's really rough. But the bravery here of being willing to be Emmett's voice in this, right? Because you know he's going to go to a better place after he's done his work here. We have life missions. We don't always understand what they are. Like I'm over 60 years old and I'm starting to understand some of mine. He already is fulfilling a life mission that we're becoming aware of.
Yeah.
And you're helping make that possible by informing everybody about newborn screening that's not expensive for something that's devastating, that's easily, not easily, but fairly easily treated to prevent the progression.
Yes.
I mean, there are examples of kids, I think you know these examples because you're now so connected with Krabbe and, that, and all that, who have this same condition and are fine, right?
Yeah. There's another family in Oregon. Their 8-year-old, he has no symptoms whatsoever of Krabbe, and he was transplanted at 4 months of age.
Wow.
Unfortunately, his older brother had to be diagnosed, and he was too far progressed, and he passed away 2 years ago in March. So.
Wow.
From Krabbe. So, but he saved his brother's life.
He saved his brother's life, and Emmett's going to save, along with all the others who are a part of this movement, save the life of maybe your child or your best friend's child who's going to go ahead and get this screening done. I mean, there may be other tests that will come down the pike that will do the same thing, but for right now we're aware of this one that's very affordable. And so it's absolutely worth doing.
Yeah.
Yeah. And this is one of the reasons we're doing this video, is that people need to know that it's $50 extra to do the leukodystrophy panel.
Just the leukodystrophy.
Just the leukodystrophy. Or $100 to do a whole panel of over 60 tests. And there's very few states that have
all 60.
All 60. You want to talk about insurance for your kid. Leukodystrophies, I did not know this until you hooked me up to this information. It affects 1 in 7,000 people.
Yeah.
That's not rare.
Right.
We now know there's lots you can do.
Yes. Yeah.
So this is a real plug for expanded newborn screening across the country, state by state. And if it's not happening where you're having your baby, just get on this Hunter's Hope Foundation. And I'll show you, actually, stay right there. What you can get through a link from them is this kit comes to you, Newborn Screening Step 1. And you know, you take that to your doctor and they just do it. It's just like newborn screening that's done state by state. A little drop of blood is just placed on filter paper and you get to send that in, and within a week you have your results. Pretty impressive. God bless you for sharing this message of hope for everybody that's watching.